A very good afternoon to one and all. Welcome to this Empower Hour. This is organized by ANI, Association of Nurse Executive India, who's committed to patient safety. And it is a series of Empower Hours which are being arranged by ANI organization. And this time, Delhi chapters has got the opportunity to host this ANI Empower Hour. My welcome to all the NA executives, members, and each one of you who is present with us. And a special welcome to Captain Sanjay Shankar, President, Delhi State, Delhi, Haryana, NCR, President. This is our opportunity we have given to our young nurses, students. We often talk about the errors happening, but we forget about, is it being done intentional, or even if it is done unintentionally, what is the suffering a person goes through, the person who has done some unintentional harm. So the silence is heavy, unrecognized, unheaded, unattended, and we often do not listen to what they are going through. The second victim. I hand over to Captain Sandhya Shankar to take it on further and introduce all the panelists and take over the lead. Over to you, Captain Sandhya Shankar.
Thank you, ma'am. Thank you, Dr. Aminda. It's indeed a pleasure sharing the podium once again with you. Friends, a very warm good evening and greetings from Association of Nurse Executives India, Delhi NCR chapter, and the team and the group of panelists here to host you and to bring to you one of the most unspoken and a not uncommon topic today before you. The second victims. The term was first coined in year 2000, not very old. In the year 2000 by Dr. Albert Wu, who actually recognized the pain and the distress in the healthcare providers and mentioned that the healthcare providers who experience emotional distress following an adverse event and a medical error or an unexpected patient outcome can be categorized as a special category or a phrase or the words is the second victim. We never thought. We talk of empathy, we talk of compassion, we talk of sympathy, we talk of teamwork, we talk of relating to each other's incidences, we talk of putting ourselves into the shoes of others, our colleagues. But what about sensitizing the healthcare workers, our own peers, on what they go through once they experience the adverse events or unanticipated events? To you, we bring here a very diverse group in this panel, and interestingly, from all pockets of nursing practice or nursing profession. We have a junior nursing student, we have a senior nurse student, we have a budding team leader from the floors, we have a nurse leader, we have a nurse academician. We have all of them today before you to share their part of story and pearls of wisdom. And I'm delighted and honored to introduce Miss Anu Rohil, a third-year BSc student, a nursing student from Apollo School of Nursing, Indraprastha, New Delhi. Anu, very soft-spoken nursing student, was candid enough to step up when the word was shared between the fleet of nursing students. And with her, another very courageous girl came forward, Miss Alina Babu Jacob, a fourth-year BSc nursing student from the College of Nursing, Holy Family, New Delhi. Thank you, Anu and Alina, for stepping up today to be with us. It takes a lot to come on to such forums. And salute to you. We're proud of our next generation of nurses. And while the students will share their bit, we do have a practicing nurse, a team leader from Medanta, the Medicity, Gurugram, and from the Department of Transplant. She is in one of the niche and most complex environments where Ria carries out her work. Miss Ria Sharma, she brings her own experience in dealing with her staff nurses and sharing her own story. While dealing with the patients, internal stakeholders like doctors, and of course the patients, their attendants, their relatives, and most importantly, the nurses. In the course of an event, handling this entire gamut of people, probably the nurse leader or the managers are forgotten what they undergo. And of course, thanks to Ms. Gigi, our Chief of Nursing from Fortis Memorial and Research Institute, Gurugram, for stepping up on this requirement, inviting volunteers to be willing to share her piece on in such an very important and interesting events which has happened in her organization, in her hospital. So thank you, all the panelists. And in addition to you, to add to your experience and of course share learnings from today's panel and from the subject, and also sharing some of the best practices will be spoken by Miss Marilyn Flinzy, who has been seen both the sides of the fence services as well as an academician, principal of School of Nursing, Apollo. Miss Marilyn brings with her the wealth of experience from both the sides, but in crisp manner will be sharing some lessons with our participants today to take home. With this, I open the stage and I invite our young budding student, our Anu Rohil. Anu, uh, I'm still fresh with that expression of yours when you first spoke to me on your story, but I really want you to now. I'm not going to interrupt you and want you to share your story with our colleagues who are logged in here listening to you. Over to you, Arun. Sorry, Anu.
Thank you so much, ma'am. Namaste, everyone. I extend a very warm good evening to Captain Sandhya Shankar, ma'am, President of Any Delhi chapter, Dr. Ramendra Kalra, ma'am, Vice President of Any Delhi chapter, Miss Marlene Flincy, ma'am, our principal, and all my elder and younger colleagues who have joined virtually. I'm grateful to Any Delhi chapter for giving me this great opportunity. Thank you. I am Anu Rohil, a student of GNM third year from Apollo School of Nursing. At the outset, I will share my experience. I will never forget that night shift at hospital when Miss Anshu, my batchmate, and I was posted in a medical surgical ward. And it was pure chaos. While we were checking patients' vital, a staff nurse approached me and asked me to disconnect an IV drip because the patient needed to use the washroom. I went to the patient's bedside, greeted her, and noticed that the medicine was being administered through an infusion pump. Since I wasn't very familiar with operating it, I asked the assigned staff nurse for the help. As she was busy, and quickly she instructed me to press the off button to stop the infusion. Following her instructions, I returned to the patient's room, pressed the off button, and disconnected the IV drip. But I forgot to close the IV set. After checking if the patient needed anything else, she said no, and with the help of her housekeeping, she went to the washroom. I then left the room. When the patient returned, she noticed that some medicine was dripping from the IV set. She got furious and pressed the call bell. As the medicine was extremely expensive, costing around 3 to 4 lakh rupees. Since I was attending to the another patient, my friend Anshu responded to the call. The patient, assuming Anshu was responsible for disconnecting the IV, started scolding her loudly for wasting her such a costly medicine. When the team leader and the staff nurse heard about the incident, they also reprimanded Anshu. However, Anshu firmly stated that she hadn't disconnected the IV. Suspecting I might have done it, the team leader asked Anshu to call me. Despite knowing the truth, Anshu stood up for me and confidently said, Anu couldn't have made that mistake. Then she came to me and explained what had happened. When I heard, I was shocked and overwhelmed with guilt. My carelessness had caused trouble for Anshu, and I had wasted patient's expensive medicine. My heart pounded as I replayed the moment in my head. How had I been so careless? The weight of my mistake troubled me. I felt an unbearable sense of shame and anxiety. As I imagined the patient's anger and the consequences of my actions, I kept questioning myself, why hadn't I been more careful, or why hadn't I double checked before leaving the room? Tears welled up in my eyes, but I held them back. I was afraid of being blamed, of losing my team's trust, and of disappointing myself. The fear of facing the patient and the staff worried me. I was worried about whether Anshu would be angry with me or she refused to work with me in future. But to my relief, Anshu wasn't upset after learning the truth. Instead, I felt deeply grateful for her kindness and loyalty. She has taken a stand for me, but when I didn't deserve it. The worst part was that I hadn't even realized my mistake until it became a problem for others. I felt embarrassed and ashamed but didn't have the courage to face the patient. When I finally went to the team leader to accept my mistake, she counseled me. She reminded me that nursing is a team effort and we work together to provide best possible care. She also advised me to be more careful in future and always double check my work before leaving the patient's room. Looking back, I recognize my mistake, but I am grateful that nothing worse had happened and determined to learn from the experience. That night, I learned a valuable lesson. Even honest mistakes have consequences, but they also serve as opportunities for growth. Thank you all for your patience in listening to me. Thank you.
I said, thank you, Anu. Thank you. And the composed manner you spoke actually is also reflective of the confidence and the gratitude which came in at the right time. You were fortunate. You were actually fortunate. And so, moving on to Anu, I invite Miss Alina. Alina is a fourth year BSc nursing student from Holy Family, and of course, a very passionate Bharatnatyam dancer. And this I learned during our course of interaction. But Alina had a very interesting experience to share with all of us. Over to you, Alina, today.
Thank you, ma'am. Good evening, everyone. And I would like to thank you, ma'am, and Kalra, ma'am, for giving me this opportunity to share my experience with everyone. So the incident with me it is a very recent incident. It took place last month only in February during my evening posting of pediatrics. So I was posted in PICU, in Pediatric Intensive Care Unit. So during my shift, staff came to me and asked me to provide feed to the child, and she handed over me a sachet and asked me to give it with the feed itself. So I gave it to the child. Later, the mother came and she pointed out कि आपने कितना sachet use किया, and I told that I used the whole sachet. Then mother said, no, you shouldn't have used whole sachet. It should be given half only, as the child was receiving that sachet since birth only, as he was a known case of seizures, and it was an anti-epileptic sachet. So immediately I got really numbed, scared, didn't know what to do, who to approach, what to tell to the mother. So immediately I called to the staff and told her, and the whole situation turned into a big chaos. Everyone was very scared. No one was ready to take responsibility, and even staff put the blame on me that I told you to provide only half sachet. Why did you put full sachet? That time I really don't know that if the staff told or not. I just put blame on me. My confidence was shattered. I didn't know how who to approach, what to say to anyone. Then my shift got over. I came back to my hostel and cried my heart out that day. Whole night was a trauma to me. Didn't know what to do, and even my friends got scared, looking at me like, "Was it that serious? Did anything happen to the child? Why is she so crying? What happened with her?" And I couldn't even express my feeling out. I was so in guilty regarding in thinking about the child's condition. Will something happen with the child? I was so ashamed to face the mother and tell her that, explain her the situation. I didn't know what to do. So that uh,
I would say, Alina, it was just moving like a picture while you were talking. Thanks for being so expressive. It's very difficult and something common what Anu spoke and what you said as fear, anxiety, and most important was guilt and shame. It was probably you experienced it more because it was a mother's child, and any mother would react, would panic, would further get scared that okay, a wrong medicine or an inappropriate dosage being given to their baby, her baby. Uh, Thank you for bringing it out, but did anybody reached out to you? You cried in the hostel. You said that everybody was concerned now. You did not had courage to go back to the ward. Of course, mother of a baby must have really worried and escalated all over. We do understand. I'm able to visualize the scenario. But yeah, anything happened after that?
yes, ma'am. After that, ma'am, next early morning itself, I approached my teacher. I told her the whole incident. I explained her, my teacher and my principal, and then they both calmly explained me and taught me regarding my mistake. They was a huge support for me throughout that situation. They helped me to come out that through that
Come on.
trauma. The principal ma'am told me to learn from this mistake and turn it into a positive thing, and which will help me to make a responsible and confident nurse in future, so that I can be vigilant while working and giving patient care. So they helped me to boost my morale and my encourage me to learn from my mistake, which really helped me out through that traumatic situation. I didn't know if they weren't there, what how would I face that situation.
Thanks, Alina. Rather, I would like to put across one point to Ms. Flinzy and Dr. Raminda that these two students really deserve a trophy of courage for stepping up. My message to all the students from the college who are logged in here is look at the protective environment you study, you live in, where you get the support from your faculties to stand by your side and encourage you, teach you the right lesson, and speak the right words. But, friends, once we walk out of the college, what happens next? The ocean, it's like an ocean where we professionals are thrown. We start navigating our path in the professional life. We handle patients independently, where no tutor, no professor, and no principal is around, right? And then that's a completely a different story because every life matters. We can't deny we are in the profession of handling, touching, and making a difference to human life. So, bringing you to the our next panelist, Miss Riya Sharma, from a team leader from the transplant department of Medanta, the Medicity, and she has something as a professional nurse, being a team leader, and has she's something very interesting and sensitive, being going to be shared by Riya about her nurse and about herself, her experience from the floors. Over to you, Ria.
Thank you so much, Pam. Good evening, everyone. It's my pleasure to introduce myself. I am Riya Sharma, currently working as a renal transplant nurse. So today I want to share an experience where my staff was deeply impacted and in return taught us about the meaning of resilience and support. Recently in our department, one of our junior staff member was handling the injection rituximab, which cost around 40 to 45,000. When she was handling the injection vial was so badly or tightly embedded in the plastic socket that when she tried to remove the vial slipped away from her hand and fell down. The moment this happened, she was terrified, she was trembling, and she started crying what to say to patient and how to deal with situation. She was completely blank. And as a team leader, I escalate this matter to our senior. Our management step into this matter and did the corrective and preventive action. But the staff was totally impacted with this situation. She was crying again, over and over again, and she was apologizing over and over again. But with the help of our seniors in charges, the issue got resolved, but the staff loses all her confidence. She was not able to do her work. She loses her confidence that whenever she was doing any medication, the flashback happens again, and she almost loses her all confidence. That was the
No,
story, ma'am.
but Ria, now this is something a new nurse in her first job has committed a mistake and, living with fear. This nurse is very vulnerable and they are quite young, quite raw when they come from the college and they do make mistakes. Anything you as a team leader and such an experienced and excellent nurse could do to help her, or she left, this is the common trend we also see that she left the job, or the nurses they just leave the job quietly, when not able to, and we blame them that they are not non-adjusting or they are not adapting to the hospital environment. We come across with so many incidences like this. But anything of this sort you experienced, or was it completely different at your end?
Ma'am, as a team leader, I supported her. I counseled her that we will support her at any situation. For a couple of days, we accompany her whenever she was doing any medication so that she can regain her confidence again back. And with time, she regained her confidence again. And now she is doing her duties with proper dedication and full confidence.
Wow. Hats off to you, and just hope that we get not one or two, but infinite number of sensible team leaders like you. You know, the hospitals will be a completely different place. But thank you for being for what you are, and continue doing this great work. We are really and truly proud of you. Friends, moving from
Thank you.
Ria and Anu and Alina's story, I'm moving to something really different. Something really different because most of the people logged in here who are managers, in charges, nurse leaders, supervisors, those who manage a team even for 4 or 5 patients, 4 or 5 nurses, have got a completely different experience. And I'm reminded of year 2010. 2010, when there was a global outcry. It was all over the newspapers and social media when one of the nurses in the United States had committed suicide. And a pediatric in ICU nurse called us, her name was Kimberly Hiat. And yes, Kamal, you guessed it right. All of it, it's a very recent story. And I can't stop sharing with all of you. I'm reminded of it because I too was immensely disturbed, but it gave me a very interesting lesson of life. And Kimberly was an experienced pediatric ICU nurse. And on one day, she administered by mistake, unknowingly, she administered an overdose, a fatal overdose of calcium chloride to an infant, which had serious repercussions. Overdose. Realizing her mistake, she immediately reported the error which she has committed. But as a result of reporting the error and seeing its severity, she was terminated from the job. Though the hospital did play an important role in mitigating the issue and saving, addressing other concerns, but her license was actually placed under strict prohibition, which prevented her to find a job anywhere in the state. She was filled with guilt, ashamed, and of course, complete isolation. And now, with this, it was 6 months later, living with guilt and professional isolation, we learned that she finished herself, she died by suicide. Now, nurses, her tragic story has actually led to a lot of discussions of punitivity, harshness, and vulnerability of the healthcare providers, the nurses, on what they undergo. Because there is another aspect when the nurses have to become that sponge to absorb everybody's overflowing and overwhelming emotions. And most importantly, the nurse managers, the seniors, and the nurse leaders, who are most of the time the victim of compassion burnout, emotional burnouts, and of course exhausted with these type of situations, and we never come to know what the person sitting in front is doing. Probably we'll plug the attrition and a big chunk of attrition the day we start sensitizing our own selves and make more sensitive in handling these people. But let's hear from one of the nurse leaders, Miss Gigi Pradeep. Gigi, would you like to share anything you have come across
Yes,
in
ma'am.
your day-to-day practice on the matter on what I just spoke and the example
Yes.
I just quoted?
Yes, ma'am.
Over to you.
Good evening, all of you. I am Gigi Pradeep, Chief of Nursing, Fortis Gurugram. In my years of working in healthcare, I have encountered many cases that left a lasting impact. A few months ago, I faced a particularly challenging situation, one that tested my judgment, confidence, and ability to act under stress. Today, I want to share one story with you. As you know, nurses often work under immense pressure, making critical decisions in real time. Leadership is about guiding and supporting, not just managing. A nurse who just completed her induction, have been on the floors, was assigned to a post-surgical patient. The doctor's order was to check oxygen saturation every 2 hourly and inform SOS. The patient was already on oxygen. The nurse monitored the patient throughout the night. Early morning, during the routine vitals check, she noticed a drop in oxygen saturation. She immediately increased the oxygen flow, ensured the patient was comfortable, and she informed the TL. The TL on duty informed the doctor. As the situation remained low, the saturation remained low, the TL announced RRT. Meanwhile, the patient family panicked and started shouting at the nurse, demanding an ICU transfer. In the urgency of the situation, the TL decided to shift the patient to the nearest ICU, which was not under the concerned surgeon. As the patient's condition worsened, the situation became even more stressful and nurse forgot to inform the primary team. The attendant was worried, emotional, and shouting, shift the patient to ICU. Why are you waiting? Shift the patient, shift the patient. The nurse was already under pressure. While shifting the patient, her thought was, I need to act fast. I just want to save the patient life. At that moment, her priority was survival, not hospital protocols. Patient moved to the ICU and survived. She wasn't thinking about which ICU the patient was supposed to go. Her instinct was to ensure immediate care. The concerned doctor, unaware of the nurse's intent, started shouting at the staff, assuming negligence rather than a crisis-driven decision. Once the patient was stabilized, the senior consultant arrived, furious about the situation. He blamed the nursing staff and assuming nurse had not checked the patient properly. Sandhya ma'am, as a leader in front of me, my young nurse was shaken and in tears. Of other hand, patient relatives were shouting and questioning me about my caliber of the nurse. And the surgeon looked at me and questioning that what your nurse did this without telling him. This incident has been escalated to the entire hospital as if thinking that something went wrong in the nursing team. That was I wanted to share with you, ma'am.
Gigi, I really adore you for your clarity and such a transparent and an honest manner. When you actually created the entire picture, it appeared that we were actually visualizing, we were seeing in front of us. And yes, every nurse manager and a nurse leader who's logged in here will relate to your point. Is things happening, what a nurse leader, a nursing head, or an in charge or an manager undergoes, and the type of transactions and the dealings they need to do to set things right. Okay,
Yeah.
fine. And I'm sure you people are quite experienced and the situation was amicably handled.
Yeah.
Did your attention got drawn to that poor nurse who was just a fresher and this was her first job? And it was only few days she has hit the floors in her life, in her profession of her professional life.
Yes, ma'am.
Yes, what happened to her? I'm actually curious to know what happened. Actually,
Yes, ma'am. That's what I wanted
your
to tell you.
leadership. Yeah.
The very next day, I spoke to the nurse to understand her side of the story.
So it
He was
means
still
24
shake.
hours, a day
Yeah,
later. A
yeah.
day later. Oh.
Yes, sir. Yes, ma'am. A day later, she was still shaken and unsure if she had done the right thing or wrong thing. Then I met the surgeon and explained the reality that the nurse acted with the right intent under pressure. After hearing this, I called the nurse in front of the surgeon, and the doctor appreciated her efforts, and she was so happy and relieved. The same nurse who was in tears that day before now felt valued and confident again. As a leader, I believe in analyzing the entire situation rather than reacting immediately. In this case, I remain calm and quiet instead of jumping to conclusions. I asked myself what went wrong, why did it happen, what led the nurse to make that decision. Usually, it's my habit to analyze the entire situation rather than reacting.
Thank you so much.
Thank
Thank
you,
you
ma'am.
very much because it takes hell of efforts, lot of
Yes,
efforts in training ourselves to control and to manage our reactions. And I'm glad actually, to see that the needle has moved and this is setting a right context. So thank you very much. Thanks from my side for preventing one absconding and one attrition.
thank you
Yes.
so much, ma'am.
Yeah. All right. And while we have heard very interesting aspects from students, senior student, from a practicing nurse, a team leader, and from a nurse leader on the vulnerability of the nurses and what they've undergone and what their situation has been like. Let us also hear from an eminent academician and who is an experienced nurse, and to share something which she has picked up from all the panelists, and also share some best practices, which are some practical takeaways for all the participants here to take home. So, Miss Marilyn, I invite you to share your views.
Namaste, ma'am. Greetings to you all from Apollo family, and thank you for this great opportunity. Myself, Madeline, principal in Apollo School of Nursing, New Delhi. Ma'am, first of all, I want to thank you for taking this topic because it was an eye opener for faculty and myself. Because many stories, until otherwise it is not a big one, the students don't share with us. And when we told the students that we are having a webinar, you come up with the stories, then there are a lot of stories coming up with even we were not aware of. Then that day, me and my faculty, we decided like how a mother will ask to a child every day after the school that what happened today in the school. Like that, hereafter, we are going to ask our students every day what has happened in the clinicals, what you went through, what was your learning, was there any problem, do you need any support, like that every day or every week we will ask the students so that we have something to support them and some learnings from them so that we can train all our other students. So after hearing to all the panelists, the student nurses and the staff nurses and very eminent nursing head, so I was reminded of the three possible recoveries which a second victim, a healthcare worker who unintentionally committed a human error, and because of that, the patient has underwent an adverse event, and they go into a three stage, like either they drop out, like they leave the job. They leave the job if they don't get any support. But after listening to all these stories, one thing was very clear, that what Anu mentioned, Anu had got a Anshu stood for her. And when she informed to us, the faculty also supported. The faculty said, you should have informed to us before, at least we would have learned, or we would have conducted a training to all the nurses, like how you should manage an infusion pump. So, and what Ria has mentioned, Ria stood for her own staff nurse and she supported her. And Gigi ma'am spent time in, she was ready to listen to her nurse, her version. And Anila had a teacher and a principal who supported her. So the support system, they all seek a support, and that support system helped them. That's why they didn't drop out. So the one recovery point was prevented because they were all supported. So the one thing a second victim has to do is they have to seek support, and they should not, because means all of them has undergone the real emotions. They had fear, fear of self blame, guilt, and they are very anxious. Alina said she was cried throughout the night, and these all emotions they had. And if they would not have got a good support, if no one would have supported them, what would have happened? We can't even imagine. So they would have dropped out. Like as you mentioned, the story of a nurse who committed suicide. If she would have got a support, somebody would have told her, it's okay, you lost your nursing registration, there are way out, life has to go on, there are many possibilities. So she should have become a activist of patient safety as well, taking her story as an advocate. She should have so there is no one for her them support. So the first recovery phase is dropping out. That was fortunately prevented in all the cases whatever we have seen. The second one is surviving, that very well explained by Ria in her story, that the nurse, after joining back the incident, she was not confident enough to handle. Whenever she took up the medicine, she was very scared whether it will drop out from her hand. So that was a phase called thriving, where the nurse come back to work but with lack of confidence. There also she needs the support. There also she was supported by her colleagues, and then she went into a phase of thriving. That is the third recovery phase, that they regain confidence, they learn from the mistake and grow professionally. So these three phases of recovery was very clearly explained in all the stories what we have learned today. So, my opinion, when a second victim, when a nurse or a staff nurse or anyone who commits mistake, and they have to first seek for support, they should acknowledge their emotions. It's very natural. Yes, you will have fear, anxiety. So instead of subsiding them, they should flow in the process of that emotions. And third, it's not that one mistake is going to define. Anila said, why, how I did mistake, she was having a question about her future. No, as a nurse, how I could, I would have done this, medication error like that. So no need to be blamed. That one incident is not going to define your competency. So be compassionate, be kind to yourself. Kindness is not for others, kindness for us as well. So there should be a self compassion also. So from all the talks, the thing what I felt is, a second victim always needs a unconditional support. They want someone to listen to them and encourage them, and they don't want anyone to judge. Okay, one thing I want to specify is, if you don't have any words to support the second victim, please don't be judgmental on them. Yes, you would have done that. I know from which college you got training. Oh, you are training, what they have taught you in the training, things like that. So an unjudgmental environment they want, and give them a second chance, and boost them so that they can have trust in their competence. And we have to provide them when they need a professional help. So that one thing which comes here is the second victim support program. So we have one in our institution, we call it as ESCA. It is emotional support towards coping anxiety. So we have a form. We as the problem happens, one side the RCA takes place, the other side the charge nurse has to assess the nurse and her physical and emotional feelings she has to understand, and she has to give them some time off, and she has to After 48 hours, she has to again reassess her, and if she needs any professional help, then she will be referred to the ESCA committee. And ESCA committee comprises of a nursing superintendent, a person from the medical director, and a quality person, and a clinical psychologist who will help in to support the second victim. So this is what I want to say.
Thank you, Marilyn. You just summed it all in such an impactful manner, and that makes you a true academician, you know, to influence students. And no wonder your students love you so much. It was impressive, but it was very simple to understand and correlate from what all other panelists have said. And to sum it up, what Miss Marilyn and our expert panelists and our dear friends who have shared their stories have said. Friends, second victim distress is actually real, one of the most true and real situations which a nurse undergoes. Could be anybody. I am narrowing it down, and this session is focusing on nurses. You will remember, those who have been loyal to Empower Hour will remember the 2023 series, the first series of Empower Hour, where me and myself and Tamil Nadu chapter head, Miss Dr. Jyoti Clara Michael, we spoke about reacting versus responding. Friends, this is just a sequel. I'm placing on records. Our channel has all the recordings in place. Anybody can go and this thing, because I picked up few of the learnings and bites from that session to bring it here. And our panelists did mention here about reacting and responding on what to choose, which emotion to choose. Second was, so it's a very distressful and real situation for the victim, for the nurse. No, it's the emotional trauma, the fear of losing the job, and also the deep guilt and shame. And of course, I used one term, professional isolation. There's an professional isolation which comes in multiple forms of being judged or in forms of loose comments or sarcastic comments, which is again traumatizing to the person. Let's step up and rise to from where we are on this front to help each other, to hold each other, and of course propagate one statement which I always say, to err is human. Those who work are liable to make mistakes unless until it is grievous and life-threatening. Probably it is repairable in a very professional and a mature manner. So punitive culture, it worsens such situations and the outcomes. The organizations practicing punitivity and unpleasant reactions, even though they don't practice punitivity, but do experience reactions from the superiors, experience high turnover. We call it attrition in our language, in our daily practice. And that's the reason there is something which probably as a country we need to mature. The healthcare system in our India need to mature in progressing towards having these second victim support programs or second victim support groups. One of the best practices, Miss Marilyn did mention the ESCA, but there are the multiple other programs which hospitals can envisage, plan, and of course, stand firm, holding each other towards the interest and the strength of the team, more importantly, in the benefit of our core interest, that is the patient safety and patient experience. Thank you very much. And I invite Ms. Dr. Ravinder, ma'am, your final words of wisdom, as we always, all of us look forward to.
Thank you so much. And I must thank Captain Sandhya Shankar for selecting this topic. And at this forum, I would really like to especially appreciate both the students, Anu and Alina. It's very easy to talk about the mistake of others, but to accept the mistake and to have the courage to talk it openly in such forum really requires a lot of courage. And that really needs to be appreciated. And it had been nice hearing from Ria how she is supportive. It's a good lesson for everyone, all team leaders, all managers. Merlin also talked very nicely about how they are helping and how immediately after realizing that the students are doing mistake but sometimes not revealing, how can we provide the support to them? And all the things, all the panelists have had a beautiful discussion. Thanks a lot, and my special thank to all the participants who have joined. It is we learn from each other. We need to learn from our mistake and also from the mistakes which have been done. And I think we are all committed to supporting our professionals, our nurses, and helping them to improve in their future practice. Thank you so much.
Thank you, ma'am. Thank you. And over to our facilitator and the organizer, Ms. Kavalji Troberoy and Ma'am Thangam Gomez. Ma'ams, over to you for opening the question house.
Thank you so much, Sandhya. I mean, we all have been victims in our career, and we have all, as leaders, handled the second victims in our hospitals. I know how tough it is, but I must say kudos like to you and the team and Dr. Aminda. It takes lots of courage for these students, young nurses. ये प्रोग्राम का नाम ही आईना है और ये सब हमें आईना दिखा रहे हैं. So this is something, they are showing Aina, which is wonderful. They are sharing their experiences. Gigi must have handled every day one problem or the other. We are just talking, it's just a tip of the iceberg, right? So, but they have done a wonderful job. Excellent. I just wanted to add one point in this. We are talking about healthcare professionals as second victim, right? Now, just to add on, there are more victims, that means. If we are the second victim, then there are more victims. So, victim number one, patient and the family. Victim number two is ourselves, healthcare professionals. Victim number three is hospital reputation. And victim number four is all the subsequent patients. If we are not relieved or taken out of the situation or handled or supported, we land up impacting many more patients, which is like a dominoes effect. So I would just want to say that it's very, very, very important for us to support our teams. And like Marilyn said, we all, each one of us must see in our organizations, how can we create a support group within ourselves? Not necessarily it has to be a multidisciplinary, even within the nursing team itself, we can have our own counselors and small, small areas, at least the nurse knows where to approach. The fear should not be there to speak out. That's what I would like to say, Sandhya. Thank you so much. Your topic was so interesting. I mean, I was just looking forward that this is going to be a wonderful topic and sharing. Thank you.
Thank you. Thank you. Thank you very much. You suggest we wait for some time and a few seconds, inviting any comments
Yes. So it is
or
open
any
to the
questions.
house. So please, any one of you can either share your experience or ask some questions, or you can give some recommendations. It's open to all of you. We do have time in our hand.
So, thank you, Sandhya, and the entire team. I always say, Kal acha hai, Kal acha hoga, because these kind of topics were never discussed.
Yeah.
These are all new things, and I'm very, very happy that in my era itself, I am able to see all these things. So, I always believe there is hope for tomorrow. When I look at all these young nurses, Anu, Alina, and Ria, their confidence, their ability to share what didn't go well with them, that all points that tomorrow when they become leaders, they will remember these experiences and probably handle the situation differently. When Kawaljit was mentioning about victim number 3, 4, so there is already documentation for victim, third victim. Third victim is the department which is not the primary department. It could be a lab department who gave a wrong, report. Something happened to the patient. So there is documentation, there is research around third victim. Now, but it was very nice when Kawaljit mentioned about multiple victims and dominoes effect. So in all this, there is a permanent victim. That is also important to be recognized. That is the nursing head, who is a permanent victim every day, isn't it? While the young nurses are, definitely going through a tough time, the team leader could be going through a tough time, the in charge could be going through a tough. So all the nurse leaders, they also suffer, and it gives them also immense stress. So it is very important to have those narratives also going on while we are discussing all this. But it's fantastic that all these things are coming out in the open. But the acid test remains. What do we do differently because you came to this webinar? That is one question I would like to ask all of you. Sensitization webinars are very good, but all the people sitting here, what would you do differently because you came to the webinar and you listened to all these deliberations? So when something happens, do we respond, oh my God, फिर से वही कर दिया? That's, I mean, without even thinking, our body language, our words just come out of our mouth. In a webinar like this, we are very poised, we tell all the right things. Obviously, we are expected to tell the right things, right? But the question is, really in our real life, are we able to take a step back, take a deep breath and say, okay, let me not react, let me respond? It's, believe me, ladies and gentlemen, it takes immense amount of practice to stop reacting. If I'm saying that at the age of 65, I'm telling that from my own experience. I was also not always able to respond. I used to react. Sometimes I used to take the help of humor. मैं अपनी लोगों को मजाक में बोलती थी, अब क्या करूं, मैं अपना सर फोड़ूं, आपके सर पे फोड़ूं कि मैं दीवार पे फोड़ूं, कहाँ फोड़ूं, ये बताओ. So that humor used to de-stress me a little bit, and then I'll say, okay, let's see what happened. Okay. It took a lot of practice. It's very easy to tell. So it's important to invest in practice. Sensitization, very good. We are happy to hear all the young nurses speaking up, but all the young nurses who come here, they are the cream. Maximum of the nurses may not even dare talk. Someone is talking to them. So that environment needs to change. And I think a lot of responsibility lies with all of us, nurse leaders, to change that environment so that people feel it's okay. I can go and tell. So Kamaljeet gave a suggestion. Maybe you should have a position which is in the nursing department where they are the listening ears. Give them some title, give it in the department, and say, and this person should not get into, um, you know, uh, counseling for corrections. They should not be. They should be the people who are only listening when someone wants to talk. That something didn't happen right with the patient, or they can even have grievance against their own in charge or supervisor. Where do they go and talk? Is it required that it has to be all the time CNO? So there needs to be some processes that we can design which works in each system. So thanks to the Delhi NCR team bringing this very important topic out in the open, and getting these young nurses to come and discuss three different scenarios. And this is as Kamal ji said, probably it is not even the tip, hardly tip ka bhi tip hoga. That's it. There's so much that is happening, right? So I really hope that 103 people sitting here, the youngsters who are sitting here, you are going away from here with this knowledge that the leaders are willing to listen and support, and you need to assist. You must have the courage to speak up and say that's it. And we all have come through that. Please don't ever think wrong that we all are sitting here without going through any such, mistakes or something ourselves. We have been there and we are now here. So we are not the holy cows of the world. Yes. So we have our own share of burden that we carry. So please be open, ask, speak up. And to all the, seniors sitting here, let's try to create an environment where people at least are not scared to say what they want to say. without us being very judgmental and reactive and say, oh, no, 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 this is not the way it should be. Oh, no, no, it happened with me also. The person has not even finished saying what they wanted to say. This can be a problem that we are not good listeners. Now, for any kind of responsiveness, the first prerequisite is to listen. Reaction does not need to listen because you hear two sentences, two words, and you react. So I think great initiative, and we keep thinking in Annie, what more can we do? Hopefully, we will do something as we are, getting more support from industry partners. We'll see what more we can do so that we can be a help to all students and nurses if they want to talk to someone who is outside their system. Maybe we will come up with something like that. Such thoughts have been coming in from our members on and off, not only from for young nurses. आईना सिर्फ स्टूडेंट्स और यंग नर्सेस के लिए नहीं है, आईना हमारे लिए भी बहुत ज्यादा जरूरी है, राइट? तो आईना हम सभी के लिए बनाएंगे. So
True.
thanks everyone. That's really fantastic. Thank you so much. And
Pleasure, ma'am.
anybody else want to have any comment or any thoughts? We still have 2 minutes before we wrap up.
Come.
Yeah.
Yes. So next month also we want to see many more nurses actually joining in, because next month we are going to have presentation from Madhya Pradesh. So hoping to see many more such exciting topics coming up.
Sure. So this is Association of Nurse Executives India's initiative to reach out to young nurses, frontline nurses and students, because they are not the members. The members are usually leaders. By the way, I should not forget to announce that our 5th annual conference, Anicon 2025, will be held at Grand Hyatt Kochi on 30th and 31st of May. And the competitions are open for students and nurses. I'm sure that if you ask your seniors who are members, they should be able to tell. 31st March is the last submission date. And so you get a chance to showcase either research or innovations or green projects. There are 3 categories, so feel free to participate. Otherwise, we always invite you to come to Kochi and be there in the conference, meet a lot of people, learn what is being discussed, and make your network, bigger, because network is very important for any professionals. That's why Annie exists, to empower nurses in India, and we are moving our needle every time a little bit. And yes, thanks to all the leaders, any leaders sitting here, for making the world record attempt also fruitful, and we have crossed a good number at this time, and we are hoping to make a number that will not be easily beaten by anybody else. So thank you. That's exciting time for all of us. So let's celebrate nurses in the coming Nurses Day. And please remember, the theme this year is about the well-being of nurses. So this topic that you chose is very apt. And when it comes to well-being, it cannot be discussed without talking about the nurses being the second victim. So kudos to the team and thank you so much. Yes. Anybody else from the team? I see Durga and somebody else, Davinder. I see a lot of senior people sitting here. At least you can open your video and encourage the young nurses sitting here, Anu, Ria, and Alina. There are some messages coming in. Please go ahead. Feel free to be on the video and say whatever. Simil, you want to say something? Davinder, you want to say something? We have one more.
Mini
Yes,
Varghese, Mini Mole Varghese. Yes, please. Please go ahead.
So, good evening, all. So, this is very eye-opening session, I must say. So, even we learn so many things that how a sportive environment can encourage our young nurses. Because sometimes the girl that today only, even when she has to tell the incident, she was just crying. So we can feel how much stress she has felt during that incident. So main thing is everyone we have to learn and we have to support our team every time, whether they are right, whether they are wrong. Because otherwise, if we people will not support our community, nobody will going to do that. And we should make them capable so that they can handle the stress level also. Otherwise, they will be burnout. So this is what I can just add. Otherwise, all the leaders they have told so wonderful things.
Thank you, Dr.
Thank
Tavinder.
you, Dr. Devinder. Thank you. Mini Varghese, you were saying something. You wanted to say something?
Simil, you're on the video. You want to
Yeah,
say?
Simil. Yes.
Hi to everyone. It was nice and
Yes.
very much enlightening session. And I like to appreciate all those girls who showed the courage to confess in front of everyone and to share their experience, how they felt, and to yes, this type of and looking forward for this type of sessions ahead also. Thank you so much.
Oh,
Thank you.
thank you. Thank you very much.
Okay, Sandhya, your last word before we wrap it up. Yeah.
Thank you, ma'am. Thank you, everybody. And most importantly, thank you, little heroes. And my colleagues here, Gigi, and dear, Dr. Ravinda, you're always been there. And of course, Kamal, our facilitator, you are too effective and efficient. And the way you pushed and then politely you reminded, but you were firm in getting it done. And hats off to you. And we are confidently sailing here. So Ria, Arun, Anu, Alina, Marilyn, as well as Gigi. All of you, big thanks to you on behalf of this power team and Dr. Kalra. All of us from Delhi NCR extend a very heartfelt gratitude and thanks to you. The take home message is three things. When we say in the course of an event, in the course of a medical error, if I am a manager, I'm an in charge, or I'm a leader, let me take a pause and count 5. It's a matter of panic and where I'm actually going on to a sprint, but count 5 to stop myself for and stopping that emotional spurt to occur. And if I am a staff nurse or I'm a clinical nurse who had been experiencing and who had actually made an error, stop yourself, assimilate yourself, because this will give you strength to go and find out anybody whom you trust, whom you can confide into, be it your educator, be it your manager, be it your head of nursing. Go and talk to them and confront. This is the first thing. Do it without fail. Second, please and please do not keep it with yourself, because only thing it is going to do is going to make me more scared, going to work and impact my self-esteem and confidence, also going to impact my well-being. It will make me more depressed. If not depressed, it will make me sad. So don't keep it to yourself. Speak. This is the second thing. And third, very important, not for the second victims, not for the people who are committing errors. It is for each one of us in our professional and personal lives. In case we see an event, an adverse event, an unanticipated episode happening in front of us, let's not be too quick to tag or to judge them. We will take time, but at least allow ourselves, in case we are impacted or concerned, we are answerable. Please let's focus on the why, and the 5 whys. On why did it happen? How did it happen? Right? And how this would have been prevented or situation would have been better. But these are the 3 mantras or 3 points to take home for each one of us who have logged in here. Thank you very much for being with us. It's been a great hour and great experience today. Thank you very much for the encouragement, dear seniors and the colleagues and the youngsters. Thank you, panel. Have a great evening ahead. With your permission, ma'am, we would like to close this panel today. Thank you. Thank you. And this was the third Empower Hour of Association of Nurse Executives India, third Empower Hour in its third year in continuation, trying to make an impact to the nurses of India. Stay empowered, stay informed, stay knowledgeable, and work on yourself. Help each other, hold each other. Thank you and have a great evening ahead.
Clap to
Bye.
each one of
Thank
you.
you. Thank you, ma'am.